Okay, the topic I chose is direct access. So first I'm going to talk about what direct access is. So direct access is defined by the American Dental Hygienist Association as the ability of the dental hygienist to initiate treatment based on their assessment of the patient's need without specific authorization of the dentist, and they're able to treat the patient without the dentist being present or the dentist authorizing the treatment. So why is this so important is because there's so many communities that have limited care to dental services due to barriers such as financial issues or transportation. Lack of access to oral health care is huge in the United States due to disparities. Direct access allows the hygienist to help and prevent oral disease around the community. So it kind of varies state to state on what hygienists can perform practicing direct access, but usually they can perform cleanings, provide fluoride, place sealants, educate patients, do an intraoral and extraoral examination, and then if there's anything concerning, refer the patient to a dentist. And these services usually take place in public health clinics, community centers, underserved areas that do not have access to dental care, mobile dental units, and schools. Now I'm just going to talk about the benefits of direct access. So, direct access gives the community equal access to care, to dental care that they may not have. And this helps prevent disease in people throughout the community, detect early disease, and it educates the community as a whole, helping them have access to dental care and also knowledge of the importance of oral hygiene that they once did not have. So this is just kind of a picture of how direct access is growing throughout the United States. We see in 2008, 28 states were allowing it. 2011, it moved up to 34. 2017, there was 40. And then in 2021, there was 43 states allowing direct access. So most states that allow direct access require some type of agreement between the dentist and the hygienist. They usually allow the hygienist to provide basic oral hygiene treatments without prior authorization by the dentist in predetermined high need settings and without direct supervision. So they'll, like I said, just cleanings, fluorides, sealants, OHI. Um, And in some states, such as like Colorado, California, New Mexico, dental hygienists may own their own practices. Requirements to reform in such capacities kind of vary, though. Like I said, state to state, it varies on what you need in order to practice with direct access. So I just pulled up the Arkansas requirements from the ADHA. So for Arkansas for a hygienist to practice with direct access, they must have malpractice insurance, collaborative care permit 1 and 2. One is 1,200 hours of clinical practice experience or taught dental hygiene courses for 2 of the preceding years. And then 2 must have 1,800 hours of clinical practice experience or taught dental hygiene courses for 2 of the preceding 3 years and completed 6 hours of continued education courses. So in Arkansas, the dental hygienist, they can treat children, senior citizens, ages 65 and older, and people with developmental disabilities and long-term facilities, free clinics, hospitals, Head Start programs, residents of homebound patients, local health units, schools, community health centers, state and county correlation institutions. But the dental hygienist must have a written agreement with no more than one dentist. And so basically, in conclusion, direct access is so important because there's so many people out there that don't have access to dental care. And so stepping up as hygienist and being able to go out in the community and provide these cleanings and provide oral health education and at least just knowledge to these people that don't have the access to dental care is so important to help improve the community's oral health and all. And so, yeah, these are my references. And thank you.